There was a well-known study called Jupiter, which found it was looking at the effects of people who were taking statins and the extent to which it cut their risk of heart disease. I won't go into the ins and outs of the study because it's quite a complicated thing at one, and I don't have all the details to hand. It claimed to have huge benefits, and subsequent analysis suggests that they weren't nearly as large as was claimed. But it was one of the first studies to come up with a very clear signal of a raised risk of diabetes for people who were taking statins. If you talk to people who are in favour of statins, they will tell you that the huge benefits of taking statins outweigh the smaller risk of developing diabetes. But that's another discussion, I think. But exactly what goes on is not quite clear, I don't think. There's an effect on the metabolism, and possibly, although this again is rather speculative, but I think, and there are some papers to support me, which would suggest that reducing cholesterol levels in the brain may not be a good idea, particularly in older people, because cholesterol is an essential part of the functioning of neurons. It's one of the parts that makes up the wall of the neurons, and if it's not there and it's not working properly, you're going to have problems. There's also evidence that people who are on statins, some people have a condition that they sometimes describe as brain fog. Their brain and their mind doesn't seem to be functioning quite as well as it should do. They can sometimes have blackouts, they can sometimes have behavioral changes and so on. It's one of those things that for quite a time the mainstream official bodies talking about statins and heart disease and so on dismissed it as really just anecdotal claims. The evidence has been building up that something may very well go on for people on statins with their cognitive function. So again, it's not a clear and definite condition, but it would suggest, particularly since the older people tend not to very often have rather low levels of cholesterol, and low levels of cholesterol in older people seems to be associated with certainly a poorer immune function and maybe not so good resistance to infection and so on. And there have been some studies which show that higher levels of cholesterol among older people allows them to live rather longer. It increases their lifespan. Again, it's not the kind of research that gets done that there's a lot of big trials on, so quite a lot of this is speculative, but I would have thought that the chances that statins would benefit you in terms of brain function is unlikely.